Okay, good morning. This is James Metzger from PrognoCIS EHR. Thank you for waiting so patiently for us to get the webinar going this morning. We've got some great solutions from Surescripts and PrognoCIS about tackling medication non-adherence. And we are going to be joined today by Surescripts, Mr. Scott Matunis. He's their Product Innovation Director. Good morning, Scott.
Hey, James. Thanks for having me.
Sounds great today, Scott. Sure, it's sunny and wonderful where you're at. Where are you located today?
I'm actually in our nation's capital in Washington, D.C., so it's quite nice out here.
Great place to be. And I'm joining you from San Jose, California, so we're going to be partnering on this remotely. So our agenda for today is going to be learning about Surescripts, learning about medication non-adherence, and thankfully the Surescripts solution for medication non-adherence. PrognoCIS and Surescripts have been partners since May of 2016. We've been working closely with Surescripts on providing e-prescription tools and a variety of other certification processes that PrognoCIS has gone through to get up to Surescripts standards for maximizing value in an EHR when working with prescription solutions. And currently, Surescripts is integrated with many different aspects of PrognoCIS EHR, and the solution that we're going to be talking about today is another point where PrognoCIS and Surescripts are going to be working basically from the same screen. So, Scott, why don't you tell us a little bit about Surescripts and what additional value Surescripts is bringing to PrognoCIS customers?
Sure. So some of the folks on the call may know Surescripts as the e-prescribing company, and that's sort of where we had our beginnings, but we do other things as well. So little known fact, we're the largest health information network that was essentially purpose-built to put actionable intelligence in the hands of care providers at the point of care. And we do that through partnering with retail pharmacies, payers like pharmacy benefit managers, EHR technology solution providers like PrognoCIS, and of course health systems and physicians. And so, here we're going to highlight the PrognoCIS solution today and really show you a really cool new feature that is available.
It sounds like you're in a perfect position to talk about the issue at hand today, Scott. Surescripts has all the data, and here we can see a little bit about what the issue is for the topic today. Feel free to continue enlightening us.
Yeah, I mean, let's really start with the macro issue here. So, medication non-adherence is a national epidemic according to the Center for Disease Control. 5 out of 10 of your patients that walk through the door probably are not taking their medications as prescribed. It's a pretty astonishing stat. I myself see myself in that stat as well. And this really costs the healthcare system hundreds of billions of dollars annually. And so it's incredibly important for care providers to be aware of this issue while that patient's in the office.
And so, as far as the importance of the need to address adherence, what are some of the drivers here, Scott?
Yeah, so it's all sorts of different things, and we'll kind of get into that a bit down the road. But it's a complex issue, and it's a fairly stubborn issue. So non-adherence has been around for decades, and there really hasn't been anything out there yet to move the needle. A lot of adherence is behavioral based, and so clinicians and care providers, I think, are well equipped and well situated to really drive improvements here. And especially for patients with chronic conditions, that are taking maintenance meds to really sort of mitigate the progression of those diseases. Adherence is critical, and we see some of the reasons why it's important to address adherence. We talked about the cost to the healthcare system. people with chronic conditions that don't take their maintenance meds are more susceptible to, being hospitalized, obviously creating harm to the patient and, increased costs as mentioned, particularly for care providers in value-based arrangements, taking risk on the health and outcomes of their patient population. This can definitely impact the bottom line and, is critically important for care providers.
So a little bit about the awareness for the care providers here.
Yeah, I mean, it's interesting. So one of the key challenges for care providers is really bridging, what we call the information gap at the point of care. So we see that just over 50% of issues are never surfaced during a patient visit. So, these issues are sort of under the surface, and without kind of what we call actionable intelligence that's patient-specific, it's really difficult for a care provider to, identify and diagnose an issue. But
aren't the questionnaires looking in the brown bags working, Scott?
Yeah, so many care providers, put workarounds in place to identify these issues. And, as you mentioned, here are a few methods that are kind of in place today. We see that, some practices have pre-visit medication questionnaires where they'll actually hand a checklist for the patient to fill out, or, brown bag medication reviews. So literally asking, grandma or grandpa to bring kind of a brown bag full of all of their medications. And I think, as we know, this is a time-intensive and fairly error-prone process. And, there's definitely room for improvement, both in terms of workflow efficiency and effectiveness.
So opportunities for improvement are out there, you say. Are there better places to address adherence than in the bathroom or in the medicine cabinet at home?
Yeah, well, I think obviously, the doctor's office is probably number one. Obviously that's where these prescriptions are being written, and also, patients trust their healthcare provider almost more than any other professional in the country we see, and so they can really address some of the core causes to non-adherence that may not be sort of obvious. So here we selected some of the key causes to non-adherence, and as you can tell, a number of these causes can really be addressed by the care provider. So, a lack of education, or awareness from the patient's point of view, obviously can be handled by, educating and informing that patient of the importance of taking their meds. Patients that have high blood pressure, for example, may not necessarily see the day-to-day symptoms of that chronic condition and thus may think that, taking the medication is not really that important. So these are the types of things that the care provider can really, kind of talk through to enable, better adherence rates.
And then in terms of the AMA, I see they've got numerous steps. We're not going to have the bandwidth to go through all 8 today, but I see you've selected a specific step. So yeah, Surescripts is focusing on item number 2 for the process here?
Yeah, absolutely. So to your point, so American Medical Association, put out 8 steps around addressing adherence, at the point of care, and obviously this is such a big issue that they felt it necessary to release these guidelines. We'll talk about step 2 because that I think is really where our solution kind of fits. And so this is about developing a process for routinely asking about medication adherence. And the way it works in a nutshell is we streamline this process through integrating patient-specific actionable intelligence within your PrognoCIS workflow. So the key here is, you don't have to read a fax, go through, the U.S. Postal Service mail, or have that kind of protracted conversation with the patient without, first seeing the available content within your workflow. So wanted to just highlight the types of content that you'll see within PrognoCIS today. So things like adherence summaries, basically a red, yellow, green indicator, visual indicator as to how well that patient's doing to their particular maintenance meds tied up to a particular disease classification. So if your patients have diabetes, high cholesterol, or hypertension, and they're not doing so well, or even if they are doing well, you'll know by using PrognoCIS. And the other two message types I just want to highlight are around missing medications and high-risk medications. These are sort of gaps in care-related medication insights that are also sent on behalf of a patient's health plan or pharmacy benefit manager.
So now that we've seen a few of these different message types, how about a walkthrough? Sample use case would be great. You mentioned diabetes before. Seems like you've got a little workflow here for us.
Yeah, so this is just a typical example of how this product kind of would work within your practice. And so, in this case, we see that John is joining us for a visit today. He's a diabetic with hypertension, and he's visiting his primary care doc. When John visits his doctor, the night before eligibility transactions are run, and that really triggers all of the message content that we highlighted on the previous slide, and that is integrated in real time within the patient chart of the PrognoCIS environment. And so, while that care practitioner is reviewing that patient chart, in this case, he identifies that adherence is an issue for John's statin medication, and so that arms him with the information that he needs to have that meaningful conversation with John. And he actually learns in this case that John is unaware of the correct dosage amount, so taking 2 pills instead of 1. And so after kind of informing John of that correct dosage, John now understands what is needed and why it's important, and promises to use as prescribed.
And let's see what these messages would look like a little bit more in the EHR here.
Yeah, so the next few slides are kind of for PrognoCIS users for the reference, and so we've partnered very closely with PrognoCIS to make sure that these insights, as mentioned before, are not kind of pulling you out of your workflow. We want to make this as easy to use as possible, and so there are really kind of 3 jump-off points within the PrognoCIS environment that you can access these message types. And so we'll kind of walk through each one in the subsequent slides. So yeah, the first one, is in the encounter screen. There's the patient face sheet. So this is that heads-up display that the many care providers kind of see during the front part of the patient visit. Care providers taking vitals and reviewing historical information, et cetera. And here we highlight, where our solution, kind of first jumps out. So you see the adherence summary on the bottom middle part of the screen. There's we see a red indicator with an exclamation point with kind of the proportion of days covered, or, how often that patient is really filling that prescription. And so this is kind of that visual cue to, alert care provider that there's an issue and that there's a need to investigate further. And so above that adherence summary, we also show all of the available messages tied to that patient. Again, this is patient specific, so it is again personalized to that patient, and that care provider can investigate further. And on the next page, we also render this content in the prescriptions tab. So obviously these are medication-related insights, and so having it in the prescription tab, makes a whole lot of contextual sense. And so as you see in the bottom right here, there's a little icon for med adherence, and you can click on that icon to see all of the available messages for that particular patient while they're in the office. So the last view is really kind of a worklist view, and in PrognoCIS it's under the messages menu, and so you see that drop-down menu, in the center top part of the screen, there's a medication adherence, tab, and you can kind of click on that, and that will take you to this view, basically where there's a list of all of the available medication management messages for your entire patient panel in one place. So you can kind of proactively address these issues, either while they're in the office or even when they're outside of the office. And so, let's kind of look at what, a typical message detail might look like. And so by kind of clicking on one of these messages, that will bring up the screen you see here. And so on the top left, you have the actual message content. And so this will tell you specifically, what the issue is at hand. So in this case, it reads, health plan records show that this patient may not be taking their hypertension medication as instructed. Please talk to your patient about adherence. And so, on the right-hand side of the screen, you see all of the available medication adherence summaries for that particular patient. So in this case, we're looking at David Cross. He has basically 3 chronic conditions: cholesterol, hypertension, diabetes. It's interesting, he's doing well on his diabetes with 84% kind of fill rate, but he's not doing so well on his hypertension and cholesterol meds. So again, this gives that care provider pretty quickly a view into how well David's doing with his medication regimen. And we also offer the ability to reply directly back to the payer with this response screen. So you see the 2 radio buttons kind of in the middle part of the screen. We'll show what that looks like in the next page. Great. So when you actually respond to the message, we will basically render a pre-populated questionnaire of common reasons why adherence may be an issue. So if adherence is an issue, you see that questionnaire on the left. It may be because they're kind of unaware of the importance. Maybe there are cost issues, side effects. Maybe there are other reasons, or there's an opportunity to provide a free-form response. Maybe that patient just forgot because they were traveling. And similarly, if adherence is not an issue, we provide responses on that side as well. So what does this all really mean? I mean, here's kind of some of the key actions that can be taken after adherence is identified. So one is delivering this feedback back to the payer. What we've heard from our payer partners today is that they really value that feedback from care providers because they may be blind to some of these issues that underlie adherence, and so they can do things like tailor care management programs accordingly, and also just improve the data quality that you're seeing day in, day out. And so again, this really enables you to kind of identify why that patient's not taking that medication, and tailor an adherent solution to that patient's circumstances, accordingly. And it's really just around involving that patient, developing their treatment plan, and sort of setting them up for success. So, that is kind of our solution in a nutshell. And I think it would be really interested in hearing folks' feedback in terms of how they use it in their workflow, and how they're using the tool to really move the needle on adherence and improving patient outcomes.
So that is a wonderful summary of this integrated solution, Scott. In terms of feedback, I know that we've been live with a limited number of customers at this point, so we are getting some feedback. There might be some folks on the webinar that have not yet seen this feature implemented in their version of PrognoCIS, and we do expect that the rollout of the availability of these messages to continue to expand throughout the year. So in terms of feedback right through the tool, they've got the communication options available through these pop-ups here that you just outlined. And also, If there's additional feedback for folks that are in the program now, our product managers from PrognoCIS should be in touch with some of these providers directly. And of course, for folks who are on the webinar who want more information about the feature, you can always contact your PrognoCIS sales rep. I've listed the email and the phone number there. If folks want to start a conversation to get in touch with the rep, they can do it that way as well. So I would just encourage folks to also sign up for our newsletter. Many of the attendees for the webinar signed up from a blurb we put up on our splash screen in the application logon. But to just stay in touch with all things related to PrognoCIS, I would encourage people to subscribe to the newsletter. We're going to be sending these slides, and we will be posting an archive recording of the webinar as well. So anyone who's attended, and even those who weren't able to attend today, will get a follow-up email that will include the presentation, the slide deck, and the actual recording of the entire webinar, so they can review it in the future at their own pace. So really appreciate the attendees today for joining us to learn about this great solution from Surescripts and hear from PrognoCIS. I just want to say thank you for joining us and taking the time out of your busy schedule. Do you have any closing thoughts on medication adherence you'd like to leave anyone with, Scott?
Yeah, this has been a fantastic opportunity, and we're really excited to be working with PrognoCIS and everyone on the call. So thanks again for the time.
We appreciate you joining us, and I'm going to go ahead and wrap the webinar up for today. And again, just encourage anyone who has any questions or is looking to get in touch to reply back to the product manager at PrognoCIS if he's been emailing them, or feel free to contact us through the website. We've got a contact form on the bottom of the homepage there at prognocis.com as well. So a lot of ways to get in touch with us and stay in touch about medication adherence. Thanks for joining us today. Thank you, Scott and Surescripts, and thank you from PrognoCIS EHR. Have a great day.